National Joint Registry, it's overall tell the performance of the operative intervention in the form of arthroplasty. In the NJR, dire with or without molar exchange is included in NJR. Resurfacing procedures are a separate category along with 6 categories for THR bearing surfaces. Regarding survival analysis, it is a method necessary in joint replacement data. Survival analysis method are basically survival tables and are Kaplan-Meier curves. There is censoring, and there are 2 forms of censoring which are important in joint replacement registry. One is administrative censoring, and second is censoring due to events such as death. Administrative censoring creates differential amount of follow-up. For example, a patient is joining in 2003 will have different follow-up of longer than 15 years, while the patient which we added last year would have only 1 year follow-up. So survival analysis method allow include all the patient in one analysis without being concerned if the patient is 1 day follow-up, 1 year follow-up, or 1 decade follow-up. Moreover, in case of analysis which estimate implant failure, death events are also censored. Specifically, they are considered as non-informative censoring event. We assume that death is unrelated to the implant failure and can be safely ignored while estimating implant failure revision rate. These are described by Kaplan-Meier estimates of the cumulative chance and probability of revision or death at different times after the primary operation. Regarding the outcomes of the total hip replacement surgery, median age was 69, range was 7 to 105. The proportion of all hips that are cemented has nearly halved. The percentage of hybrid implant use has tripled over the same period of time, and use of uncemented implant has also doubled. Regarding the head size, the 3 commonly head size used are 32 mm, 36 mm, and 28 mm. With 22.25 size rarely used. The use of ceramic on ceramic bearing across all heads has declined since 2011. This decline is conversely corresponding to ceramic on polyethylene bearing usage. The major indication is osteoarthritis in total hip replacement. Regarding the 95% confidence interval cumulative revision rate, the cemented metal on metal is 5%. Uncemented is 6%. Indication of revision is aseptic loosening, dislocation, adverse soft tissue reactions, pain, and infection. Aseptic loosening is the most common indication of single-stage revision. Regarding outcome after total knee replacement surgery, the median age is again 69, range from 7 to 102. Osteoarthritis is documented indication for surgery in 97%. Cemented TKR is the most commonly used. 57% were TKR which were all cemented and unconstrained, cruciate retaining. Unicondylar knee surgery typically involves use of mobile bearing. Petrofemoral surgery is mostly for females. In 15 years of Kaplan-Meier estimate, PFC sigma has cumulative revision rate of 3%, and it is the best